I'm starting.
I guess
now.
I should pull my
Alright,
pant
yeah,
legs
sure,
up
the pant legs
so
up.
you can see. This is what I was talking about.
A little puffy, yeah, it's always going to be like that. Well,
It
for a
is.
long, long time, there's going to be some swelling.
Especially when I'm.
It's never going to have the same contour as before the surgery, so
Oh, yeah?
just don't expect it.
Okay.
Especially for a year, it's going to stay a little swollen, a little puffiness
Uh-huh.
in your calf and your ankle. You'll notice like
I
all of
haven't
a sudden.
had that much. I mean, I used to have.
Once you start to do
more
more,
than that.
you might notice. You might. Okay, let's bring your leg up like this. Bend your knee for me. Oh, looks great. Looks great. Great range of motion. Nice and straight.
This one is.
Nice and stable.
They still make that popping noise.
They are going to for a long time until your muscles get stronger.
Oh, that's because of the muscle.
Well, a couple of things. I'll show you in a second here. Relax here. Can I bend for me?
This
That looks great.
Wouldn't
Perfect.
been quite as well as the
looks
other
good.
one.
Looks about this. Well, it's 120, and that's what we expect
Yeah.
out of a knee replacement. So it looks good. You can go ahead and sit back up.
I played tennis last weekend.
You want the whole thing or just the
Yeah.
exam?
The
All right.
whole thing.
All right.
Is it still going?
Yeah, it's still going, and I can still see your face. Okay, there you go. So,
I played tennis.
good. So, as you put your knees to the test, so okay, your knee. So, a normal knee is made out of cartilage and has meniscus in it, so it sort of cushions that sort of side to side. If I check my own knee, my knee would wobble a little bit because that's normal, but you wouldn't hear it because there's cushiony stuff, there's soft stuff, cartilage. Now you're metal and plastic. You're
They just
all
go
right. So.
together.
If you make it too tight, then the knees won't bend. If
Ah.
you make it too loose, and it feels unstable.
I wouldn't like that.
You have to have some degree of looseness to your knee, and that's what that's what that little clicking comes from. Because that's normal. The noise is just because now your knee's made out of metal and plastic.
Ah, okay.
All right.
So, and you don't. I think I asked you this in the hospital, but I didn't do it too soon, did I?
Do what?
The surgery.
No.
I mean, when you got in there, it looked like I really.
Yeah,
did.
but I don't base it on that. I've seen people who have very little arthritis in their knee, not very little, like nothing, but like oh, they didn't look so bad. Who are in terrible pain and they do great with the knee replacement. And I've had some people who have terrible looking knees, and I do their knee replacement, and they also needed it. So I don't base the decision on what I find in surgery. I don't base it on the X-rays. I base it on the combination of what I see before the surgery on the X-rays, based with your symptoms. And that's how we base it. But no, I mean, you definitely have lots of arthritis in your knee. I didn't see anything like, ooh, should we have done this or not? It seems to be clearly the right decision. All right.
That's good.
Are you done with
Too
physical
late
therapy?
now. Yeah.
Right, you can't go back with it anyway.
I got released
Okay,
quite
good.
some time ago. And I, at the gym I do, I'm trying to get a lot stronger again. So
Yeah.
I'm back to, I do the Stairmaster, I do the bike, and I rode my real bike finally. I waited a while on that, but
Okay.
I did that. And I do all the leg machines, but not nearly the weight I used to
Yeah,
do.
just like you're
Um,
you're gonna do something one day, you're gonna push it, and it's gonna hurt, and that's okay. You can't break anything, you can't dislocate anything, you can't pop anything, but you certainly can strain stuff, okay? So
strain the other things.
you can strain the
Not the
ligaments,
knee
the
itself.
muscles, some scar tissue, so any sort of like, oh, you got a bruise now, oh, it's more swollen now, not a concern, just means you overdid it and something started just, swelling, which is normal. So especially for an active person, they're gonna put it to the test, they're gonna gradually build up. So any swelling you have from a heavy exercise program, even some bruising, all normal.
Should I still ice sometimes
You
after
can,
I
yeah,
do?
if you feel, you can treat your knee basically almost like a normal knee at this point. You're going to stretch it, you're going to strengthen it. If it hurts, you're going to take some medicine. If it's swollen, you're going to put some ice on it. If it doesn't feel good when you do something, you're not going to do that yet. So just just basic rules,
Okay.
basic common sense rules at this point.
Yeah, so I think they're doing. I mean, if I didn't
No,
have my Achilles problem, I'd be really good.
All right. So, but I think the knees look perfect. I don't expect much more flexibility, okay? Because these knee replacements are only designed to go so far. Maybe on your left knee, you're a little tight there at the end point, so maybe you'll get another couple degrees out of it.
Should I work on that bend, or it'll
Just
just
get to
come
that.
with?
Just get to that. Just
the
stay
lowest
at where you are now. Just
Okay.
stay at that comfortable position, but don't expect you're ever going to go heel to butt.
Okay.
Normal.
I don't know if I ever did.
Right, but don't expect that. That's not the
Okay.
goal of this. So where you are right now is very, 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 very good for a knee replacement. In fact, what I would consider to be exactly what I'd hope for.
Oh, good.
Your left knee, but I find that patients find where their comfortable spot is, and when it still feels a little tight, that means maybe things need a couple more degrees, or they just need to get comfortable at that spot.
So, I forgot what I was going to say. Anyway, I'm mostly working on strength now. I'm not really working the bend like I did in the beginning? You know,
Yeah.
trying to really force it
Yeah, I
more?
think at this point, maintain your flexibility. Still work on the stretch straight. Still work on just maintain what you have because stretching is good, and then
And I'm really
work
trying
on your
to
strength.
get the strength
Yeah.
better. And I do, you know, I make sure I walk stairs, you know, instead of the elevator every time and all that.
Yeah.
Trying to
Right.
get strong again because I did get a little flabby.
All right.
In the,
All
so
right.
how do you rate my recovery with other double knee patients? I know you don't want to say.
Once again, I find every patient's very different. What I can tell you right now is I have zero concerns for you. Like I find that you're doing extremely well. I don't have any concerns. A lot of people a lot of people through the process like, well, here's what you should work on. Here's what you should work on. I wish this had gone better. I wish this was a little different. I really don't have any of that for you. I think everything looks good. You'll find your comfortable position with how strong your knees will get, with how you'll still feel at the end of that bend, where you still feel a little tight, where you finally just go, boop, that's where it goes and it's done. So that you should keep working on. I see a lot of people at the 3-month mark, and when I tell them, hey, everything's great, they stop doing stuff.
Yeah,
and then all of a sudden I see them at the 1-year mark, and they're like, they've lost a lot of their, not a lot, they've lost some.
That's not going to happen.
Correct. So whatever you're doing is working.
No,
so just keep it up.
Trying to really get them much stronger.
So at this point now, I don't need to see you back until the year mark. So I'll see you back next February.
Okay.
You need to take antibiotics before you go to the dentist.
Oh, right.
I put a prescription in for clindamycin. It's two tablets, 1 hour prior to dental work. There's 6 tablets, so it'll cover you for 3 dental visits plus a refill. You do that for 2 years.
Just one refill. Oh, I thought I was supposed to do it forever and ever.
No, even that's controversial.
Oh, really?
Even the
I used
2
to
year
do
thing.
it for mitral valve prolapse, and they quit doing that. So.
It is controversial. Some dentists will say, oh, I thought we stopped doing that. I thought there's no recommendations. The answer is there is no recommendation. What we know is that for the first 2 years, there's more blood flow to your knee as it's healing. And so I figure that if there's bacteria in your bloodstream, it could go to the knee. I think the risk of taking a couple antibiotics before going to the dentist for those calculated first 2 years is still worth it. Now, if some patient told me, listen, I don't like the idea of that, and there's no research to prove it, I'd say absolutely, you're right. There's very little science behind it, but we've been doing it for a long time. There seems to be some anecdotal evidence, and so I continue to do it for 2 years.
Now, let's just say if I were to feel like on a weekend that I'm getting like a urinary infection or something, which I never get so far.
The chances of a urinary infection going into your bloodstream are extremely rare. If you had a urinary tract infection and started to feel a little flush and sick and chills, that would be different. So, how concerned should you be with an infection? Not so much. What you should... If you know you have a UTI, fine, go get it tested, go get it treated. If you're just like, I felt a little funny today, you don't have to rush to the doctor and see what you
I'm just concerned, like, let's say I'm out of town or somewhere where there's not a Kaiser, and I feel like I really need to have...
No, you should not just take antibiotics for I think I might have something. No, you just...
I mean, usually I don't.
Right, and even a urinary tract infection, the chances once again of it going into your bloodstream because the urine is a contained environment, it's so slim that if you were a bad diabetic or had some sort of immune system problem, that'd be one thing. But no, I have no
concerns for that. So I don't need to worry about any of that stuff.
Nope.
Good.
Nope. All right, good. Well, I think everything looks good,
Okay.
and I will see you back
in a year.
At the 1 year mark, yep, February 26th, okay?
Okay.
All right, good. I think the recording came out okay.
Let's see.
Uh-oh.
Did it go off?
Oh, no, you just had a